There has never been a better time than now to come join the Bellisio Foods team. Bellisio has a new contract in place with plenty of awesome perks for their employees. From increased wages, access to the free health clinic, vacation after 6 months, and much more, Bellisio Foods is committed to putting their employees first. For more information or to apply, visit BellisioFoods.com/careers. Take advantage of these great new employee benefits and join the Bellisio team today. Visit BellisioFoods.com/careers to learn more. We at Orange Crush have many things to be thankful for, including everyone who makes Orange Crush a part of their day. To show our thanks, Orange Crush, WKOV, and participating Save-A-Lot locations will be giving away Thanksgiving turkeys to dozens of winners because even though Thanksgiving celebrations still might look different this year, we know Thanksgiving favorites will still be a part of your plan. Visit GJPepsiContest.com/turkey to find out where you can enter to win now through November 18th. No purchase is necessary. See official rules for details.
Well, good morning, everyone, and welcome to another edition of the morning show right here on Main Street TV, where we are here today with one of our wonderful, superb, excellent doctors from Holzer. Welcome.
Oh, thank you. Thank you for having me.
Oh, we're so happy to have you here. And let's just start off the morning by having you introduce yourself.
All right. I am Dr. Rajesh Rajan. I'm part of Holzer, part of the nephrology team at Holzer. And I've been with Holzer for about 5 years now.
Okay.
And, you know, I have 2 little kids, Debu and Dhiren, 11 years old and 9 years old, and a beautiful wife. And I'm a kidney doctor, and that's the thing. As a kidney doctor, what we do is we deal with kidney diseases and kidney issues, okay? And I think it's important for everyone to understand that kidney disease is actually very prevalent everywhere throughout the United States and the world.
Yes.
And I think it's an important thing, just everyone be aware of kidney disease in general.
Yeah, and as I was reading down through some of the, they give me a little bit of talking points here, and, I got to nephrologist, and I thought, oh my God, I have no idea what that is. And then I started reading a little bit more, and that, you said it, kidney doctor.
That's right.
So kidney disease is prevalent then.
It surely is. And in general, in the general population, it is very prevalent. So the viewers out there, you may know one person or another in general who may or may not have it. And a lot of times, this is diagnosed based on labs. You may not realize that you have kidney disease per se, unless your labs are routinely checked by your PCP, and then they can establish the diagnosis.
That's right. And Brett says you're the best. There you go. So no, and very, very sweet guy. I can promise you that. So let's talk for a minute about, I guess, as you said, you may not know you have kidney issues. So, I go to the doctor once a year. By the way, shout out. Went up to, and I'm proud to say, went up to the Holzer yesterday, got my mammogram like a good little girl.
Very good. Very
whoop,
good.
whoop. It is October. Thought that was fantastic for that, and was treated very, very well. Thank you, Ladina. I love you. But that being said, yearly you need to go, at least yearly, get that blood work done. It's important.
Absolutely. Again, we can pick up on certain things. Just to provide just general health care, it's important to look at your lab values, cholesterol, how your kidneys are doing. So it's always a good idea to kind of maintain a connection with your primary care physician.
Even if you don't want to hear the results,
Absolutely.
Which none of us do.
And I'll tell you one thing. We've had several patients who've never been to the physician. They haven't seen a primary care doctor for many years. They get admitted, and then they're in florid kidney failure, and then that's bad. So we don't want to ever get to that stage. So It's always important just to kind of routinely do your routine labs and checks.
That's right. And, most insurances, I feel like, or there's at least some kind of relief of going that once a year because they want you to go and do preventive.
Absolutely.
Preventive maintenance, just like you do your car, right?
Exactly.
Oil changes and whatnot.
Exactly. It's a very good idea.
Yeah, absolutely. So step one is make sure that you keep up on your labs and your yearly exams and things like that.
That's correct. That's correct. This way, your primary care can kind of gauge how everything's going, and if needed, we can always send you to a specialist or anyone if they feel like further investigations are needed.
Okay, and that's kind of where you come in. So, what would be like? Say I go to my yearly doctor and I get my yearly labs or once every 6 month labs or whatever they recommend, because you have to listen to your doctor.
Yes.
Right?
Yes.
So whatever they say. So say something looks a little funky on your kidney test there, because that would be one of the things they would normally test for, right? Just like to make sure everything's functioning properly.
Absolutely.
Yeah.
The kidney labs come with just the basic panel
Just normal.
That's always done by your doctor. So it will be checked. And if something's a little bit off, and again, sometimes your primary care may retest it just to make sure. And there are certain tests, we do blood work and we also do urine tests as well.
Okay.
And from that, we can pick up, if there's any kind of inflammation or any kind of issues that could be underlying with the kidneys. And then they would try to treat it, or the primary care may send the patient to a nephrologist where we will do further investigation. And a lot of times it's going to be re-education. Nowadays there's a lot of stressors that can affect the kidneys. And we kind of educate our patients on what's good for kidney health in terms of diet and everything else in general.
Okay, well, let's go down that path for a minute. I'm guessing 12 16-ounce Mountain Dews a day is not good for kidney health.
Negative. Absolutely not. And, this is the trend that I see.
It's very prevalent in our area.
Surely is.
And I don't know if it is everywhere, but I know it's prevalent in our area.
It is. I mean, soda, pop, it's not good and everyone knows that. And we have to try to move away from that and more water. Absolutely.
Yeah. So what would be some of the other things that you see that people just on the daily, due to their poor kidneys, that that maybe they don't even realize is bad for them?
Well,
obviously soda.
But again, we're kind of minimizing the other risk factors. So the main risk factors are going to be like high blood pressure and diabetes. A lot of times, diabetes is one of the number one causes of kidney disease. So we have to be careful, and we have to work really hard in controlling that. So limiting our sweets in general, like if we look at our diet, there's a lot of sweets, everything's loaded with sugar or salt. So trying to curb your sodium as well as your sweets is going to be one of the main things that we need to do. Then making sure you're well hydrated. Again, coming back to that soda, pop, most in the general population, we focus mostly on that, sugar flavored or sugar sweetened beverages. Instead, moving away from that, moving towards water would be the next thing. And then you have to be careful about using over-the-counter medications.
Okay.
For example, we might say, hey, just taking an NSAID or non-steroidal like ibuprofen, Motrin. We use that for our joint aches and pains.
Yeah, we all have the ache and pain, when it gets dreary out like this, and
exactly.
The knees hurt, and
that's right. So, but what happens is because it's over the counter, we would think, oh, it's harmless. But we've had several patients who just excessively use it, and ultimately that can cause kidney damage as well. So things to kind of look into or trying to stay away from.
Well, and then combinations of all of that together would be real bad, huh?
Absolutely. So, and sorry to interrupt.
No,
I was
not at
just
all.
saying, in terms of kidney health as a nephrologist, we also focus on other things. The kidney is a very important organ. I love it. Again,
he loves it.
It does, it controls your blood pressures, so it's very important in blood pressure maintenance. Also, the electrolytes like sodium, potassium, kidney stones. These are all the other things that we kind of deal with in terms of nephrology.
And kidney stones are a whole other
it's a total
issue. My goodness, and it became a joke at the restaurant yesterday, but one of the guys was showing a picture of he won't care because he was showing us all of one that he had passed recently, and I mean, it looks like an arrowhead.
Yeah,
like
it can be very bad.
I was like, what is happening right now? So I said, well, you must feel better. He said, oh, I feel great now. So I've never had a kidney stone. How does that come to be? Is that genetic? Is it?
I mean, there's a component where it is a genetically predisposition to it, but a lot of times there's environmental factors as well. Again, now there are certain stones that basically if you go through the urinary tract and if it's blocked, then we need to have a urologist who would go in and they would extract the stone or do other interventions.
Okay.
From a nephrology standpoint, what we're doing is we're trying to minimize the risk factors for developing kidney stones.
Okay.
Again, it kind of goes back to the same principle: water, 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 and really cutting back on the salts. Right, low sodium diet.
Oh, you're killing us.
Those are the two foundational ways we typically treat it, and then beyond that, we do certain medications and stuff to kind of limit it, and also we prescribe certain dietary modifications to kind of help, depending on the type of stone it is.
Okay, very good. And that's the whole thing too. And he was saying that they were going to actually analyze it to find out if there's what's going on there.
Exactly.
Because it was a bit abnormal. But anyways, that's neither here nor there. Okay, so let's talk about warning signs.
Yes. So, interestingly, the kidneys are good at compensating for their function. So essentially, in the beginning stages, early stages, you may not feel any symptoms at all for kidney disease.
Okay.
And when we look at the kidney function, we look at this main number called the creatinine, and then this GFR, which is the filtration rate. And based on that, we classify the stages of kidney disease. And the first 3 stages, a lot of times our patients do not have any symptoms of kidney disease whatsoever.
Really?
Yeah. So that's why it's important, like lab work and urine tests are important.
Sure.
Now, as we progress in kidney disease, then, it's like stage 4 and stage 5 where patients are close to needing dialysis. Then you start feeling the typical symptoms of kidney failure. And there's a whole slew of symptoms like fatigue, insomnia, poor appetite, no energy whatsoever, unable to eat. And it's a very bad very bad situation at that time. A lot of times, nowadays, being that we're involved in their kidney health, we try to limit to getting to that stage. Okay?
Yes.
And again, as a nephrologist, my job is to do everything I can to keep my patients off of dialysis, and that's my primary goal. But sometimes it's unavoidable, and the kidney function can progress to the point that we need dialysis, and then we need to focus on that.
Okay, so let's back up for a minute because I know you love the kidney.
Yeah.
We have 2 of them in our bodies typically.
That's right.
Let's go back and explain for a moment what exactly the kidney does.
So
I know you touched on it, but
right, the kidneys are very important organs in terms of clearance or cleaning our blood, right? So we have all the waste products. In addition with the liver as well, it filters the blood, gets rid of a lot of the toxins and stuff. Then it has an important job with a lot of the hormones, for example, cortisol and stuff. Therefore, that's why we kind of discuss blood pressure being controlled by the kidneys as well. It's going to be a very important part of blood pressure control. Then, it actually helps maintaining like all the electrolytes, or sodium, potassium, and chloride, and all those things.
That's a big job.
Well, in addition to that, anemia. So blood counts can be low. A lot of patients who have kidney disease tend to have low blood counts, so we help manage that.
Really?
And it's important in terms of bone and mineral health. So there's a lot of things those guys do.
So we need to be kind to our kidneys.
Absolutely.
Aw, we need to give them hugs every day.
Yes,
little kidney hugs. Pet them. Tell
Kidneys
them we
and
love
heart,
them.
they go well.
So we touched on that, and you're saying typically, stage 1 through 3, because the kidney's so good at masking or working that you don't see those signs.
You may not necessarily see those signs, absolutely not. Of course, there are certain signs that you may experience. For example, one of the things is you can start spilling some protein in the urine. Those are the patients, they may start seeing some bubbles or foam when you urinate. Yeah, those are some of the things. Sometimes you can see some blood in the urine, but there are patients who may have some blood, but it's there only on the test. You don't necessarily see it visibly. So those are some of the ways that we pick up on kidney damage.
So again, this is why you go at least yearly and have all of these labs run.
Yes,
It's
very
so
important.
important. Not just for kidneys, but for everything.
Yes, absolutely. And again, cholesterol. Like the kidney health, again, kidneys, I usually tell my patients they're innocent bystanders. So if anything happens to the general body, kidneys will get affected. So it's important for very good heart health. I mean, heart, you have to make sure your cholesterol is controlled, blood pressure is controlled, diabetes is controlled, your liver is controlled. If any of the other organs are affected, kidneys will get affected.
Yes, and we need to be nice to them.
Right.
So, and drink lots of water.
That's right.
Yes. Okay, so let's talk for a minute about, God forbid, you end up in past stage 1 through 3. You are into stage 4 and 5 of kidney failure. And I assume that some of that, again, could be just the way your body's made. You may not have ever done anything.
Right.
Or you do a lot to your kidneys,
Right,
one or the other.
Yeah, absolutely. There's definitely a genetic component to it.
Sure.
And of course, the environmental. But again, certain disease processes, certain autoimmune diseases like lupus and other things can affect kidneys. There are certain, cancers and stuff that can affect kidneys. There's, again, a whole slew of things that can affect it. As nephrologists, our focus is, trying to maintain good kidney health, staying away from dialysis. But if we ever get to that stage, there's a lot that needs to be done in terms of planning, education, preparing, in case there's a need for dialysis. And it's mostly by education. We usually have to send our patients to a surgeon where they have to get like a fistula or an access where we do the type of dialysis.
Oh.
And and there's a lot behind that. There's so many there's different types of dialysis that our patients can do.
Okay, so let's talk about that for a minute. And I hear the word dialysis, and that just sounds not good. There's nothing good about it. I mean, there's good about it because it saves lives,
That's
but
correct. Yes.
you definitely don't want to get to that point. So tell everyone, explain the process of that.
Okay, so dialysis, again, we're taking over the job of the kidney. Essentially, we're doing the job of, and again, we're not able to do all the jobs of the kidney, just one part in terms of clearance or cleaning the blood. And there are a number of ways we do it. We do the conventional hemodialysis, where we have an access, a fistula, or it's usually a fistula, and we take the blood out, run it through a filtration system, and send it back into our body. That's one way. Yeah. Yes, it gets complicated, but and a lot of times when you hear dialysis, we think, okay, we have a patient that goes to a center 3 times a week, and they're sitting there for 3 to 4 hours and doing this process.
Right.
But now, nowadays, our goal is really to focus on what's called home dialysis, right? Here, in general, if we're doing the in-center, where you go to the center, your whole life is based on dialysis itself. But
correct. It's a job.
It is a job, and you're
Yes.
there, and it's not a good thing. You're there, the next day you're tired, then you're back, and it's one of those cycles. But we actually have what's called home dialysis, where we do basically what we use a catheter and we instill certain fluids into your belly. It does the cleaning, and then it drains. And this is another procedure called peritoneal dialysis that
Okay.
patients can do at home, and it's maybe a little more gentler. That's one option. And then we also have options where they can do the home dialysis at home using a smaller machine. So this way, dialysis revolves around their life instead of the other way, and it's much easier, much better for them.
Okay, so technology has improved.
To a certain degree, but we're still far behind. There's so much that needs to be done in terms of kidneys. There's so many things in the pipelines, a lot of trials going on, but we're still behind. I wish we need more technology for kidneys.
Okay, more hugs.
More hugs. Yeah.
They need more hugs every day.
Absolutely. But I'll tell you one thing: beyond dialysis, the next thing is transplant. So most of our patients ultimately, what I strive for is to try to get them a kidney transplant. And we work with CAMC and we work with OSU, and we've made a lot of referrals, and a lot of our patients did get kidney transplants. So that's one of the things that we should always consider. Consider donating, or always think about that next person, who is on dialysis.
Don't get me started on the donation, because I just don't understand why people don't do that. But that's just Jen's finger. I get my finger going here.
I see.
You don't need it anymore. That's not what he says. What I say. Go ahead.
Well, yeah. So again, those are important things to consider. But dialysis. Once you get into the rhythm, it's not too bad. But the main thing is trying to avoid it, doing everything that you can to try.
Correct.
To avoid it.
Now, so to me, and I can remember being a little girl and having a classmate. Now, this was a couple of years ago when I was in grade school. Having a classmate whose dad, and he ultimately passed, but was on dialysis. So that was a while back, and just remembering he had the thing on his arm, and you could feel it. It's like
That's right. It's a bruit or thrill.
Felt like it flowed or something. Like
yeah.
you,
it's like
you
a
could
little
touch
buzz
it.
that you feel.
Yes,
That's right. And again, it's just a connection. And there are different ways they do it.
Okay.
The vascular surgeons, they actually take your artery and your vein and connect it together, and that's how you build a fistula. But sometimes they use certain grafts where they use a different material to create this.
But is dialysis, I think about that, and you hear that, and that's a death sentence. Is it something that someone can live on for quite some time and still have a good quality of life?
I'm really glad you brought that up because, there is this belief that, once you're on dialysis, everything's over.
Yeah.
And that's not the case. Again, we have to keep in mind, I usually try to tell my patients that dialysis is just something transient. It's like a bridge to transplant. And once you get a transplant, your quality of life is very similar to the general population. And, longevity, how long you live is very similar to the general population. So that's one thing.
Sure.
But I wouldn't necessarily say that it's the end. I have a lot of patients who are on dialysis, and they do okay, but it is hard. I'll tell you, the life on dialysis is very hard because you're restricting everything. You're restricting your diet in terms of all the different types of foods and stuff that you can eat. It does become a challenge.
Sure.
It is doable, but it is a challenge. It surely is.
Well, it's a lifestyle for sure, and it becomes a job, as we said.
That's right. And if we can do the home dialysis, it makes things so much easier. But if as we get a little bit older, then it's a little bit more harder, of course.
Yeah.
So then we always kind of weigh the risk versus benefits. Do we proceed that route or not, and things like that.
So, if you get onto dialysis, is there a way to get off?
That's a very good question. So, it all depends. It all depends on how your kidneys are working before all this.
Okay.
So, there are some patients, they've had normal kidney function, and all of a sudden something happens, and they've had an insult to the kidneys. Whether it could be a pretty bad infection, or they've had some prostate issues or something that we can fix. So, like when we kind of talked about how the kidneys are innocent bystanders.
Yeah.
And if it's related to like the heart or sometimes liver or sometimes like, septic shock or something like that, and we take away that, the kidneys will recover. Can recover. There's
okay, good. So there's a chance.
There's a chance. But there are patients who've had long-standing kidney disease where you're going into stage 2, stage 3, stage 4. It's that slow progression, then it becomes harder.
Gotcha.
Then
So it's all in an individual case.
Exactly. Each person's absolutely different.
Yeah, that makes total sense. Okay, so if you are on dialysis, does that mean you're headed toward transplant?
Well, again...
Or no?
Not. Okay. Again, there are some age cutoffs, but we usually refer our patients out so they can do a thorough evaluation by the transplant center. And they kind of go through a lot of strict criteria. That you have to have the social support. They kind of look into all the mental issues because it's a major process kind of going through this. So making sure that you're emotionally stable to do that. Plus, there's so many testing that needs to be done because once transplant is done, then we do put you on certain medications to kind of suppress the immune system. And there's a risk of always reactivation of cancers and stuff. So
sure,
there's a thorough evaluation just to make sure there's no cancers and stuff. And then they'll proceed with the transplant. So those are ways that you're either accepted and put on the list or not. But of course, the other you have to keep in mind, you can be on the listing in a transplant, or you can have a kidney donation from family members or friends who are willing to support.
Mm-hmm. What's the ratio? Do you know of people that receive donations from family or friends versus just a donor?
That's a good question. I can look up the data. I don't have that on me right now. But transplant donations it's very prevalent. It is very prevalent. A lot of people do it. If you ask around, there are people who've had kidneys donated to them.
Mhm.
Yeah. Um,
So that means so basically we have two kidneys, right? So you
Yes.
can function with one kidney.
you can.
You just have to give it extra hugs.
Exactly.
Yes.
And it's not as simple just to go and donate a kidney. So the person who is looking to get evaluated for a kidney donation, they go through the same rigorous process, and they get tested for everything, and then only they are allowed to donate. So if there's anything that's a little bit off, or if there's any risk that they'll have for kidney disease, then they will be denied
Okay.
from
Which could be heartbreaking.
which could be, but it's a good thing to do, right?
Yes.
I mean, it's a good thing to kind of look just to make sure that if they are donating, that nothing else happens to them.
Well, and the thing is to make sure that the donation is going to be successful. So
Exactly.
if you're setting it up to fail from the get-go,
Yeah.
we don't want to do that.
And usually we don't. I mean, usually they look at, that's why all these checks have to be marked off. So
So you mentioned donation centers or transplant centers around here. If somebody does, God forbid, get to that spot where they have to do that, are there places around here that do such a thing?
well, the transplant centers it's usually big centers like OSU and CMC are the main ones that we send to. I've sent my patients to Cleveland Clinic and University of Kentucky as well.
Okay.
And they, actually, my patients, we can go anywhere. We can get listed in several different centers. I have patients at University of Pittsburgh. So, we have quite a few places that we can go to. I mean, it's a little far, but it's doable. But nowadays,
Well, it's your life.
yeah, exactly. And both of our closed centers, have been very successful.
Very good.
Yeah, so I'm very happy with that.
That is a super, super thing. All right, so dialysis, we were talking about that earlier, and I got off the subject, and I apologize for that, but I'm
These are important topics.
random. We do have, you drive up and down the street, and you see certain dialysis centers. If somebody is a patient of yours and needs dialysis, where do they go for that?
So, there are several dialysis centers. Like, for example, I think there's 3 dialysis centers in Jackson, and there's several around. We're associated with the Fresenius or Indian Hills in Jackson, and the Gallipolis Clinic in Gallipolis, Fresenius also.
Okay.
And there are other centers nearby as well where patients can go to, and that's where, if patients are undergoing dialysis, there's a whole staff, there's a whole team that works with each patient. We have the dietitians, the social workers, the nurses, the techs, the physicians and nurse practitioners, all of them kind of work together to kind of help. And one might think, okay, a person's going to dialysis, if they're doing the in-center, they're being seen 3 times a week, they're probably being seen much closer or more frequently, so things are looked into better.
Well, yeah, I mean, you almost have to have a concierge for your dialysis. Like you have to have somebody helping you plan all this stuff.
Yeah, and we have a great team. Like each centers, they have a good network of people that will kind of help coordinate.
They work on with you on your end, and then the
yes.
person on their end. Okay, that makes total
I'm the
sense.
medical director for the ones in Jackson as well as the Fresenius in Gallipolis.
Oh,
so I get to kind of help coordinate a lot of things too.
So that's another hat you wear.
Yes, I'm lucky to have that. Yes.
Well, very good. I'll bet you've met some really cool people along the way.
Absolutely. I have some amazing staff, and I really appreciate, and even my patients, they love the people that they work with. So I do appreciate all the things that you guys do over there for my patients, for our patients.
Absolutely. All right. So, how does somebody come to see you?
Well, so again, a lot of times on routine health examination, the blood work and the urine test, the primary care physician can pick up on this and they'll refer the patients to the nephrologist. But a lot of times, we've had patients who come on their own. They would say, hey, doc, I've had kidney issues or stones or, issues with blood pressure. And they can actually come and get established with us as well.
See, he's popular.
So, again, all they'll have to do is just call the Holzer and just ask to be get an appointment with us, and we can definitely get that arranged.
That's right.
And I have a good staff. You know, my nurses are great as well. I have a good team there too.
So, where do you practice?
I have my clinics are in Jackson, so we're in the Jackson Hospital.
Okay.
And then we and the main hospital in Holzer in Gallup
Place.
Mm-hmm.
Okay. All right. So both locations.
Yes.
That way, it's convenient to wherever.
Right. And my partners, we have Dr. Singh, Dr. Sadula, who's also covers, and we have Amber, who's a nurse practitioner that's also helping managing patients as well. So we have a whole team of staff that's running the nephrology at Holzer, and we look forward to working with our patients. And,
Very good. So, what are some of the things that people can do to? We were joking about hugging your kidneys, but what are things that people can do besides drinking water? Obviously, that's a good one to help their kidneys on a daily.
Yeah. So again, risk stratifying or like kidney protective measures. So just trying to be as healthy as you can. That's the main thing, really.
Exercise, same thing. Probably
Exactly.
diet, exercise, all of that.
Exactly. So good diet. Like we kind of talked about. Low sodium diets. Really cutting back on the sugar.
No fun.
I know. That's what my patients tell me all the time. But it's true. If you
it is. It's true. But so a couple of years ago, my husband and I went on this kind of keto thing, but I had no idea until I started that how much sugar I consumed every day.
Oh.
And I'm going to tell you what, getting off the sugar
it's the biggest difference.
It is an addiction that you have no idea.
That's right.
It is. I've never smoked, but I can't even imagine what it would be like to quit smoking. But the sugar thing, I mean, it's awful.
Oh, you're right. You're absolutely right.
I mean, you physically go through a lot to get off the sugar. And now, though, I can tell you, if I do eat, somebody got married at the restaurant, brought in a little piece of wedding cake, and so I took 2 bites of it yesterday, and I was just my body just felt so weird.
Right.
So once you can get off of it, you feel so much better.
Oh, yes.
But that addiction is hard.
It is.
And salt is the same way.
Same thing. And again, it's a lot about education. So not a lot of people realize this. If you look at the nutritional content in these products that we're using, you can look at how much sugar's in there, how much sodium's in there. And I think that should be the first step, just kind of being educated, more educated on the
read labels.
Yes, exactly, read labels. And sometimes we have to look at the resources. Some of our patients may not have the same resources. Eating healthy is more costly than eating unhealthy. That's pretty cheap. So that's one of the struggles that we have. And then kind of getting back exercising. We typically want about 30 to 40 minutes, at least 3 times a week, just for general health. Walking or any kind of exercise, and just looking at heart health. Those are all very important things, and just eating healthy and staying healthy.
Yep. And we could all lose a few pounds.
Yeah. Oh,
so
yeah.
Just do that too.
That's right.
It's amazing too, losing a few pounds and then going back and getting checked out again by, whether you have a nurse practitioner you see or family doctor or whatever. Your cholesterol, how just a few pounds can affect your cholesterol and your blood pressure.
Oh, yes. It makes a huge difference. I mean, if you look at the pictures, if you look at the pictures from several decades ago compared to now, the general pictures, you can see the trend, how people weighed much less before. But again, it's not because, it's also because of the diet, because of the industries and, how everything's loaded with sugar.
Well, and we're a society of convenience at this point.
Absolutely.
And let's just be honest. I mean, we're hopefully on this side of a global pandemic where, people were stuck at home and probably not doing the best practices, myself included, of eating, and you're kind of oh, whatever, I don't have anything else to do, so let's eat something bad.
Right. And, yes, this COVID has been it's been terrible. It's been terrible.
Yeah.
Terrible for everyone, all our patients, and so that's another important thing that we absolutely have to protect ourselves against.
Absolutely, and the mental aspect of it has been rough on a lot of people too. So
Absolutely, yeah. It's terrible. I mean, I've seen families, my patients, my dialysis patients. It's been a lot on the healthcare workers in general.
I'm glad you said that. That's my word. Everything's just a lot.
It's a lot.
That's my word. Like
We need a
people are like,
reset.
how are you doing? It's just everything's a lot.
Yeah, that's
It's
right.
just
That's one way to put it.
Yeah.
Easily.
for sure. All right. So what are some of the other things? You're the expert, and certainly I am not. So what are some of the other things you would like to touch on while you're here today?
Well, so other things, what I would probably say is just general health. That's the main thing that I probably focus on, and good kidney health and blood pressure issues. Diabetes is another thing that it kind of everything kind of goes together, right? In terms of good health. So make sure you follow with your doctors. Make sure you're doing your part in terms of staying healthy. Um, those are the main things that I would probably say.
It's like, what are you thinking? You go and you get your oil changed, 4 or 5 times a year, and you don't go to check yourself out. That doesn't make any sense.
That doesn't.
Like,
Yeah, exactly. Yeah.
this is you. This is your body.
You
This
have
is
to
your
take care of
vessel.
yourself. That's right. That's right. And again, especially now with all the stressors, with like the economic situation, the healthcare situation. There's so much stuff. So the best way to kind of take care of yourself is just doing something active, right? Just going for a jog, or maybe,
Sure.
or just going for a walk, or just trying to just take in the world.
And I'm glad you said that. Listen to what I'm telling you. We live literally in one of the most beautiful places in the entire world. We have people come from all over the world to visit our beauty.
That's right.
Take a walk.
I was just talking to my nurse, Ashley. There's so many different places. For example, if you've ever not been to Hocking Hills, that place is amazing.
Isn't it?
And the New River Gorge.
Yes.
That place is beautiful.
Yes. Unbelievable.
So those are the main, there's so many places that you can visit around here.
Correct. I mean, trails and trails of,
just get out there and walk.
Just walk.
Yeah, that's right.
Go sit on a bench at Lake Hammertown and just watch the leaves fall. I mean, just anything. Do something.
That's right. That's right.
It's
There's not
gorgeous.
the hustle of the city or anything like that. I actually grew up in New York.
Oh.
Yeah. So
shocker.
It is
a little bit different.
Yeah. So, but it's so much nice. Everything's nice and quiet, and it's wonderful.
Yeah.
Great people.
That's definitely a common thread that I hear. Even people, as I've said numerous times, like traveling through, they'll stop, get a bite to eat at the restaurant or whatever, and they'll say, "Gosh, people here are so nice. I was walking down the street and everyone said hello to me," and I was like, "Yeah."
Yeah. That doesn't
They're
happen.
like, "That doesn't happen where we're from." So,
That's right.
and that is true. You go up to Columbus even, and you say hi to someone walking down the street, they look at you, they run. Please don't let them mug me or whatever, because they're thinking you're talking to them, and that's a bad thing. But
there's a good feeling. It's a nice feeling.
It is. There's good people here.
There is. Absolutely.
Well, welcome to the area.
Well,
We're happy
I've
to
been
have
here
you
now.
here.
I'm part of the area. Thank you, though. Thank you so
for
much.
sure.
Well, thank you so much.
Well, yeah. Is there anything else you would like to tell our viewers about before I let you get out of here and get back to work? Because there's kidneys to hug today.
That's right. So I think in conclusion, I would probably say, I'm kind of reiterating what we've already said. Make sure you go see your doctors on a routine basis. Have labs checked. If there's any issues in terms of kidneys or high blood pressure or kidney stones or anything, and you would like to reach out to us, always just contact Maine, and you can always make an appointment to see one of the nephrologists in terms of kidney health. And that's about it. Thank you so much for having me. This has been fun.
Oh, it's lots of fun. All right, one more thing. What's your favorite part about working at Holzer?
I think...
Did they warn you about that?
No, they didn't.
Oh, good for you.
No, I think the staff is the best part, really. Like, I feel like my department, it's like a second family. We kind of jive pretty well, and we get to take care of patients. And our patients they really enjoy working with us, and that's the biggest thing that I like.
I love that.
Yeah, and also, working at a smaller community hospital compared to a bigger center, it can be a little more challenging because we don't have the same resources as some. For example, there are certain tests or certain things that we can do at the big centers, tertiary centers, that we cannot do it at the smaller hospitals. So it does become a little bit of a challenge, and I really enjoy that part. Sometimes I wish I had more I could use for my patients, but that challenge alone is pretty nice.
Yeah.
Yeah.
Have to think outside the box sometimes.
Absolutely, because certain treatments and stuff that we can get at other places right away, we're not able to give our patients. We have to figure out other ways and stuff. So
yeah,
that's a neat part.
Hey, well, that's good, and we're happy to have you here.
Well, thank you so much.
So thank you so much for hanging with us today. Now get back to work.
All right.
Go hug some kidneys.
Thank you.
All right, and Dr. Rajan, right? Rajan.
Yes.
Okay, I'll get it right one of these days. I'm sorry about
No
that.
problem.
Thank you. And then if you are interested in an appointment, call 1-855-446-5937. Thank you, girls, for bringing the doctor. And thank you, doctor, for stopping by with us today. All right. He's a hoot. I like him. He's fun. Okay. Let's head to the weather forecast because it is, well, kind of, it's not good and it's not bad. Let's just go with it that way. So partly cloudy skies today on Wednesday with highs around 59, lows around 44. Tomorrow on Thursday, good news is it's a bit warmer, but those silly rain showers come back into the forecast. Highs of 64, lows of 52. And then Friday, Saturday, looking like, pretty good chance of rain as well. Highs in the upper to lower 60s all the way through the weekend. And maybe some sunshine back on Monday. And it has to rain, or it has to sunshine on Tuesday because that's election day.
Oh, is that the way it works?
Well, yeah. The sun has to shine over election
I
day.
didn't know that.
Didn't you?
No.
Well, that's what I order anyway.
Okay.
Yeah.
All right.
Because I don't want people to have an excuse to not go out and vote.
Got plenty of other ones.
Right? I guess that's my point. I want to
Yeah.
make sure that they don't have that excuse to not go out and vote.
Yep.
All right, so James is here,
I
so exciting things in the sports world.
Right.
So our Benton County Lady Vikings made history
Yeah.
last night, where they won in 3 sets over Logan Elm to advance to their first district championship match in the history of the program.
Congratulations to
Way
them.
to
Wow.
go, ladies.
Right.
Just socking it to them.
Yeah. Amazing.
Yeah, they are, unfortunately, but listen, these Benton County ladies can
Mm-hmm.
just,
Yeah. I mean, these are a lot of the same girls that were on that
they rock.
state runner-up basketball team last year.
That's right. They will face top-seeded Sheridan at 11 a.m. on Saturday at Southeastern High School. So stay tuned for how that turns out.
Absolutely.
Yep. Also, something else going on, the Ohio High School Athletic Association, of course, the playoffs are going on.
High school football playoffs start this weekend.
That's right. So, to get your tickets, you can go to, if you can find this QR code.
Yeah, so if you go to the
scan
WKOV
it.
Facebook page, we have these links.
Okay.
But so you basically, if you want to go to one of the Ohio high school playoff football games,
Yes.
you have to buy your tickets online from the OHSAA.
You're not just buying it here locally somewhere.
You cannot buy them at the gate.
Okay.
So you have to go to the I always say this acronym wrong. OHSAA.org/tickets.
Okay.
And from there navigate to the game that you want tickets to.
That's right.
And this is the case for the Jackson game. This is the case for the Wellston game and the Benton County game this weekend.
Okay. So, and then the games are, and number one, just so you know, children under the age of 6 do not need a ticket.
Right.
So if you have little ones, they do not have to have a ticket. And if you say, well, I have season tickets to the stadium, so I'm good.
Right.
You're not good.
Not. Yeah.
Like that's all out the window now.
Right. Yeah.
So
you must purchase the tickets online in advance.
yeah, so go to ohsaa.org.
And the price does go up if you wait until the day of.
Oh, I didn't know that. Okay.
So if you order today or tomorrow, they're $10. If you order on Friday, or in the case of Wellston, Saturday, it'll go up to $12.
That's right. And so you can either download those tickets to your phone or actually physically print them out. Mm-hmm. Either way, that's cool. Yep. But you have to buy them online. So just to let you know about that. The the high school football playoffs for this weekend. So Friday, Columbus South comes to Jackson. And then again, that's Friday. Yep. Also Friday, Vinton County will be at Byesville Meadowbrook, which we decided was clear over by Zanesville, east even of Zanesville. And then on the 30th, on Saturday, Wellston makes that long, windy trip down to Arnton to play the Arnton Fighting Tigers.
And so for the Jackson game, originally on the schedule, the times were all to be determined.
Yes.
The Jackson game, I know for sure is 7. I do not know about the other ones. I assume that the other Friday night game is also 7.
Okay.
Saturday game, I don't know. I'm guessing it's 7 too, but we do not know for sure.
All right. So lots and lots of stuff going on this weekend. You have, the Ohio State Buckeyes playing Penn State.
Right.
And you also have Trick or Treat.
Yep.
You have these playoff games going on.
World Series.
So on and so forth.
Yep.
So it's a good weekend to not say, well, I don't have anything to do. There's lots and lots and lots of stuff
Last
to do.
weekend for the Ohio Renaissance Festival this weekend.
I didn't realize that thing went on as long as it does.
Yeah, a month,
okay.
Maybe 2.
That's pretty cool.
When they start,
Pretty neat stuff.
It is pretty cool.
Quarter Horse Congress going on in Columbus. If you are interested in that, goes on roughly 3 weeks, and believe it or not, is one of the largest conventions in the world.
Yeah. Wow.
Yep.
Who would have known?
Oh, just try to find a hotel room, as I did this weekend.
Oh. Can't find hotels anywhere, it seems like.
Oh, you can find a hotel for
$400 a night.
Correct.
Yeah.
If you want to stay at the Motel 6, it will be $349 a night.
Yeah,
awesome.
The Motel 6 is the same price as a Hyatt now.
They're leaving the light on for me though, so I feel good about that.
Well, that continental breakfast of stale toast.
Stale Danish and some the cereal and the little sealed container.
Yeah,
and they'll give
coffee in a styrofoam cup that's about that big.
All of that, but So just to let you know, if you are headed up to Columbus, is the Penn State game home?
Mm-hmm. Yep.
Okay, so no wonder I couldn't find a hotel room.
Yep.
So you have
half of Jackson County is going, I think.
Yes, correct.
I think Pete, Dan, and Dan are all going.
Are they?
Yeah, a lot. Half of our staff, I think, is going.
Yeah, a lot of people going to the Penn State game, and that is also a night game. So I think 7:30.
Yeah, probably 8 o'clock tip off.
Yeah, something like that.
Radio pregame will probably start at 7.
So it's gonna be a good one. So there you go. All right. Anything else? What else do we need to talk about?
We should tell everyone that you probably know that Total Media is in the process of moving to a new building.
Correct.
And we've moved the Telegram, and we've moved Zip Printing.
Yes.
And starting Friday, we're going to move the radio stations. So, and they plan to move all that equipment this weekend. So that is creating a lot of logistical issues for programming.
Yes.
And we are confident, as of now, I think I'm safe to say this, that we're not going to miss any important broadcasts, with the possible exception of Sunday's Bengals game.
Okay.
Is still up in the air.
All right.
But we plan to bring you the high school games, bring you the Buckeyes game. I mean, the Buckeyes game 100% will be broadcast on the radio.
Yes.
And then we plan to have WKOV and our other 3 radio stations in their new studios Monday morning. So Matt McKee will be doing the WKOV morning show from his brand new studio for the first time on Monday.
That's right, and you can come by and wave at him.
Mm-hmm. And
because he has a nice big window.
Yeah, he does have a window, so you can come stand out like the.
You can wave, you can moon.
You can do. Yeah, well, it's going to be like the Today Show. We're all going to make signs and stand out front of the window.
And wave or do
hi, Mom.
Whatever gestures you would like.
Yeah, and so connected to that, we are not ready to move our Main Street TV studio yet.
Correct.
So this is probably going to mean that for the next week or so, we will not be able to broadcast on 105.3 FM and 1330 AM in the morning.
Okay.
So if you
we'll be here.
Yeah, we will be still be on Facebook and everything, but until we are able to move as well, that radio broadcast will probably be down for a week, maybe 2.
That's right. And then because we have to be obviously in the same vicinity, and if we're not ready to move yet, then there you go. We won't be in the same vicinity.
And I will say that this should not affect election night coverage on Tuesday either. We still plan to have live radio election coverage on WKOV, and we will probably be streaming live on the Telegram Facebook page as well with Pete Wilson Tuesday night to bring you all the election results.
Okay. And then hopefully next election, when we have our new studio set up and everything, we'll be able to do a big to-do from there.
Yep.
Which will be fantastic.
Yes. Yes, it will.
This one's going to be just a transition.
Yeah, a little bit of a transition. But it just, everything just happened to be the weekend that the people that we needed to be here to do this is when they were able to do it.
Yep.
Yeah. So we're going to make it happen.
There you go. You got to
strike while the iron is hot. Our engineer Justin is very confident.
Hey, listen.
Yeah, and he is smarter than me.
Go, Justin.
Yeah. So I have full faith that that this will be almost completely seamless.
Absolutely. We've got this. So we will be moving. We don't know when, but here in the next week or so, probably.
Soon. Yep.
And then since I've driven to this building for the past 20-some years, I'm probably going to continue to drive here about twice a week.
I'm not going to miss those stairs, though.
Right?
No.
I don't know. There's a good exercise, though.
That's true. I do. After listening to him talk about kidney health,
I know.
You're just sitting back there like, maybe I have that.
I know. Maybe I should walk those steps more often.
Oh, I get tired sometimes.
I know.
Maybe I have kidney disease.
Maybe we should have prefaced that by saying, this life makes us tired right now. COVID makes us tired. Like everything makes us tired. Listening to the news makes you tired.
Yeah.
So anyway. So lots of great stuff going on this weekend. So stay tuned and we'll give you some more details. I know there's a kind of a pub crawl in town. Is it Saturday?
Saturday night.
As well.
Yep. So, man, at Stockroom 601, they're going to be giving away Ohio State tickets on Saturday night as part of the pub crawl. It's going to be live music. You guys are at 6 Cents. You're doing what is it you're doing on Saturday? Or was it? I think you posted a whole list of things that you're doing. Now I forget.
Yes.
I forget them all.
So we have some fun Halloween themed drinks.
Okay.
This week we have a really cool food special. What is the burrito called? It looks so good. Dustin came up with it, so let me check it real quick, and I'll let you know.
But there will be the Halloween costume contest will be at Stockroom. That will be at 10 o'clock, and that's the same time that they're going to do the drawing for the Ohio State tickets.
Ooh.
So if you're interested in trying to win the costume contest or those Ohio State tickets, 10 o'clock Saturday night at Stockroom. They're going to have live music going on about that same time, too.
Nice.
So lots going on.
Yeah, there's a ton going on. Okay, so the burrito is Hold on. The Cowboy Junkie Burrito. You got that?
Yep.
And it's got a whole lot of stuff in it. The drink special this week is our blood plasma. Ooh.
Sounds thick.
It actually is clear, strangely enough. Yeah.
Hmm.
Yep. So lots and lots of fun stuff going on. And yeah. So yeah, Saturday's going to be a good day. The Chamber's doing their trunk or treat.
Yep.
Downtown.
Yeah. And I mean, of course, Wilson and Oak Hill are also having trick or treat on Saturday too.
Yep.
Then Oak Hill, when trick or treat ends in Oak Hill, they're having like in the central. I think it's at the Central Park. They're having like their trunk or treat. So if you wanted a trick or treat with kids, but you live somewhere that they can't get to,
right,
come to the park and they're going to do their trunk or treat, and then they're going to do their parade of masks.
Yes.
Yeah, so
lots of fun.
Lots of fun.
It's just a good fun weekend, right?
Yep.
Why not?
Yep. I will say Total Media is participating in the Jackson trunk or treat.
Okay.
And Courtney is taking it very seriously.
Oh, boy.
So I expect whatever she comes up with to be...
in true Courtney fashion,
Yeah.
It will be off the chain.
I think so.
Because she's super creative.
Yep.
Yes.
I'm putting her on the spot now. She's
like,
maybe like,
I was gonna blow it off.
She's maybe got exhausted just thinking about it. Was ready to throw in the towel, and now I'm talking it up.
Oh my goodness, that's so funny. All right, well, got to get out of here for the day. Thank you to the good doctor for stopping by.
That's great.
And he did a fantastic job of explaining about our little kidneys. And make sure that you hug your kidney today. Both of them. That means drink water.
That means skip that Mountain Dew, even
Skip
though you
the
want
Mountain
it.
Dew. You know you want it. Cut it out. Salt. All of that. Sugar. Eat salad.
Carrot stick.
Yep. All of that. We know it's hard, but just hug your kidneys today. All right. Have a great day, everyone. We appreciate you for tuning in. And do we have a guest tomorrow?
Philip Buffington.
Oh, that's right. Phil will be here.
Newsman Phil. Because Pete Wilson took yet another vacation,
He
believe it or not.
did. Can you believe it?
Yeah.
All right. Well, have a great day, everyone. We'll be back here tomorrow with Newsman Phil on the latest and greatest since we missed Monday. So he's going to be really full of it.
Yep.
Phil's full of it. Yeah. Have a good day.
Bye, guys.
Bye.